When a patient has to handle something like their personal life, when do they do that? Usually over lunch or on a Friday, or so when they handle these calls, we need to have our best people on the phones, because that is when our phones are the busiest. So that is the number one thing, is we need to answer our phones. Okay. The second thing is training, and that's why you guys are here today. And I love that you guys are here today. I love that you're watching this video. Hey, look, it's like twins. Twins, look at us, right? Do I look better with a hat or without? Training your team. We pay to make that phone ring, and then we don't train the team on how to answer the calls, how to handle the phones. We talked about this earlier this morning. Like, we didn't go to receptionist school. None of us went to, treatment coordinator university. We didn't go to the College of Dental Scheduler. We were not trained in how to answer the phones. So we need to understand that training is vital, and we are paying to make those phones ring. Now it's our job to know what to do with those patients and with those phone calls. So not only you being trained, but anybody that potentially could answer your phone should understand how to answer the phone well. They should understand how to handle the phone calls. And think about how messed up we have this in the dental office. I don't know about your office, but a lot of offices, when we hire somebody brand new into the front office, where do we usually put them first? On the phones. So we've taken somebody brand new who doesn't know our policies, who doesn't know our doctors. They don't know the procedures we do. They don't know the insurances we belong to. They don't even know much about the practice, and we're trying them out on the phones. That doesn't work. You need to make sure that everybody who answers your phone is trained in answering your phone. And then the third thing is knowing the purpose of every single phone call. The purpose, remember the intention, the why behind everything we do. The purpose of every phone call, answering the call, is not to be friendly and just answer the phone call. What is the purpose? What did we learn this morning about the purpose of everything we do in the front office? Hashtag butts in the chair. I'm reading lips. Butts in the chair, right? So our purpose with every single phone call is to get the person to come into the dental office. So if that means they've got an outstanding bill and we're handling that, we are doing that with the best customer care possible to get the balance taken care of so we can get them back into the office to get their recare appointment. If they're calling in to discuss their treatment plan, the intention and the purpose of that call is to help them understand their treatment plan so we can get them back into the office to get their treatment done. If they're a new patient calling in and they're wanting to know what insurances we take, we need to handle that call so that we can get them scheduled and get them into the practice. Everything we do on the phones, the purpose is to get the patient's butt in the chair, okay? So we need to make sure that, one, we answer our phones, two, our teams are trained on answering phones, and three, everybody understands what the purpose of the phone call is, okay? Now, I talked about this a little bit this morning, but I want to really reiterate it when it comes to phones. I am not a fan of scripts, okay? There are a lot of companies out there that teach phone scripts. There are a lot of companies out there that teach scripts for case acceptance and scripts for different things we do in the office. And I understand that we need to have a guideline. We need to have outlines for training. We need to give them kind of a recommended options of what they can say. But we need our team members to say it from the heart, not from the script, okay? Your patients can feel when somebody's reading a script. They can feel when it's not from the heart. They can feel when they're just checking off the box. That's not good customer service. So say it from the heart, not from a script. And I wrote an article recently. I believe it's in your homework for this, so you guys will be able to read it in the next couple weeks. But from the heart is being honest, be authentic, be genuine. Don't be robotic, be energetic, be yourself, right? I'm myself on stage. I'm myself in front of patients. I feel comfortable in my own skin. I can't be somebody else. Be yourself, right? Have your attention on the patient. When you have a script, your attention is, what do I say next? What did they say? What am I supposed to answer? Is it a yes or a no, right? I've seen a lot of that lately where, what do I do if the patient says this? Do I go here or there? My focus is more on the script than not on the patient. I want to put my focus and attention on the patient. Really listen to and pay attention to their needs. And then train to be confident. Customer service comes from confidence. Customer service comes from when your team knows what their purpose is and they've gotten the training and they're comfortable, they're going to be rock stars on the phone. So this is all about speaking from the heart, okay? So now let's break down the phone call specifically. I like acronyms, as you can tell. You just heard HEART. Now we're going to talk about, for every phone call, you need to have a smile, All right. And I've already talked to you guys about the importance of smile. Okay. That's just a basic customer service rule for me. But it's the same thing with the phones. When we're answering the phones, we need to answer with a smile in twofold. First is the S, slow down and smile. Okay. That's the first step. We need to slow down and smile every time we answer the phones. Now, as you guys know, and I actually just got a review about this on YouTube, about my videos, I talk fast. I have a lot to say, okay? I'm the same way in the dental office. I have a lot to say. But if I answer the phone like this, all super excited and really fast, I might scare some patients away. And I really want to make sure I put my focus and attention on the patients. So when I smile when I answer the phone, I want to take a deep breath. Thank you for calling Scripps Rock Dental. This is Laura. How may I help you? Right? So taking a deep breath gets me to slow down, and I put a smile on my face. Even if there are 6 patients standing in front of me, the toilet's overflowing, and the doctor wants to know where their next patient is, I need to put my attention on that phone call. The second thing I want to do in the M is make the patient feel special. And again, we talked about this morning. It's not that hard to make the patient feel special. Use their name, mention them, say hi, say thank you for calling, ask them how they're doing. It's super easy, but make the patient feel like a person and not a number. Next is intention. Know your intention and your focus on that phone call. Pay attention to that phone call. I will tell you, if you work in a dental office, you're probably a really good multitasker. And if you're like me, you're probably like, yeah, I'm good. I can multitask all day long. The problem with multitasking is you're not giving anything enough attention. You're giving too many things a little bit of attention. So what we need to do is when that phone rings, or if a patient's in front of you during treatment plan presentation or whatever it is that's important like this, put your attention, intention, and focus on that patient, okay? The next one is L, which is listen well. We do a lot of talking when we're on the phones and when we're with our patients. We do a lot of, and we've said the same thing over about the insurance, and we're not in network, and yes, we're in network, and this is important, and you need to, we talk a lot, but we don't actually stop and listen. Remember, these are patients that we're dealing with. Remember, I told the story about tooth number 3, and they didn't ask the patient at all how they were doing, and how, how were they feeling this morning, and how did they feel after surgery? They didn't listen to the patient at all. They were so efficient that they talked their way through the appointment. And then last is exceptional customer service. Always offering your patients exceptional customer service, which is what we're talking about today. So we have all of this stuff for you guys with the new Patient Accelerator program. So I'm not going to go through all of this in depth, but there are phone tips for every phone call that you need to make sure your team is addressing, that you need to make sure your team understands when they answer the phone, respecting the phone, smiling, introducing themselves, listening with the intention of talking to the patient, asking meaningful questions, remembering their name, remembering your purpose, empathizing. Make sure you're trying to schedule them. Like, what's the point of answering the phone if we don't realize and remember that our intention is always hashtag butts in the chair, right? So every phone call, you need to have these basics with every call, okay?